Good afternoon, Long Beach. Today is our briefing for August 28th, 2020. Like always, we will have a Spanish translation at the end, and we have ASL translation as well. I want to just begin by noting that we have a lot of information that has been released today by Governor Newsom in the state of California as it relates to the reopening of the economy. It's actually some substantial information and news. And so we wanted to make sure, just to get in front of the community and the media today, to be able to answer what we know as of this moment. It's important to note that the new regulatory system and the new color system just came out today. And so the city and our health department is really trying to absorb and learn and answer questions as well from the state. So we may not have the answer to everything, but we will over the course of the next few days once we've also fully talked to LA County. But we do have a lot of information to share that we know about that will give us some timeline of where things are headed. And then any questions we don't have the answer to today, we're going to get from the state over the weekend, and they're going to be providing even more information this weekend, and we'll have for next week and for Monday. Let me begin by saying that currently, as of today, we have 10,437 residents that have tested positive for COVID, 69 residents in the hospital, and we've lost 212 residents to COVID-19. Our positivity rate is 8.8%. And I'm going to discuss the positivity rate in just a minute and why that matters. I want to broadly say to all the business owners and the workers, we know this has been a very difficult time. It's been devastating to many businesses, to folks that are unemployed and looking for work. But we also have a very serious health crisis on our hands, and it's facing the entire country with people that are dying every single day. As we know, we are making some progress in Long Beach and LA County, and that's because more folks are following the rules, more people are wearing masks, and more people understand how deadly the virus is. And so for us to even continue moving forward, we have to stay vigilant and strong to pull out of this. So I want to talk about what the governor announced. And then once we kind of go through where Long Beach is, and I want to give everyone some straight talk as far as what's really next and allowable. Then our health director, Kelly Colopy, is also here to help answer questions. I may not know the answer to every question, but she certainly has a great grasp on every detail of the new policy that came out. So let's start with what the governor said and what we're doing moving forward and how it affects Long Beach. The most important thing to know as we move forward is that Long Beach cannot move faster than the state allows. So I want to repeat that. Long Beach cannot move faster than the state of California allows. The second thing that's important is Long Beach, regardless of the fact that we have our own health department, is part of the county of Los Angeles. And so we also, at this moment, can't move faster than the county allows as a county system, even though we're our own city. And that's also true for Pasadena, which also has their own health department. Now, it honestly doesn't matter anyways because our numbers aren't dramatically better than LA County's. And so whether you count our numbers on their own or LA County's numbers as a whole, it doesn't change our position on the timeline. But I just wanted folks to know that we can't move faster than the state. That's the most important thing. So what did the governor say today? The governor's announcement today is putting in place a new statewide framework. The framework essentially puts out new timelines and new metrics and a color-coded system on how the state can reopen the economy. What does that color-coded system actually look like? Essentially, there are now 4 stages to reopen for businesses. There is the purple stage, which is being called widespread transmission, which is essentially where most of the state is, including us in Long Beach and LA County. There's the red stage, which is the second stage, which is substantial transmission. Then there is the orange stage, which is moderate transmission. And then finally, there is the yellow stage. And the yellow stage is minimal transmission. So if you can imagine these on, you know, on a graph, purple is widespread, which essentially is where most of the state is, including us in LA County, which means it's the most serious. And then you have red, and then you have orange, and essentially you want to get to yellow. Yellow is where there's minimal transmission, and that's when you can reopen many other aspects of the state. But a vast majority of the state is in purple, and you have some that are in red. But again, purple is where most of us are. So what does that mean for us in Long Beach and across the state? The most important thing for us to note is there are essentially now 2 data points the state is going to look at to see where you fall on this map and how you move forward on the coded system. The first data point will be looked at will be the positivity rate. And the second data point that will be looked at is the cases per 100,000. So what does that mean for us locally? So in the past, we were looking at many more pieces of data to see where we fit in the timeline. Moving forward, we're going to be looking essentially at 2 major pieces of data as the state has laid them out. One is how many cases you have per 100,000 residents. And for an example, the state, in order to move forward, wants you to have 100 cases per 100,000. We are at 168 per 100,000, so we have a ways to go, by the way. And we have an 8.8 positivity rate, which is the percentage of people that test positive that are getting tested. The state wants you to be under 8%. So those 2, so we currently right now don't meet either of the 2 key metrics to move to the next color. We are in purple, the next color would be red. And the other thing that's important to note is you can't move on to the next color for 21 days. Essentially, you're locked in. So it takes 21 days if you meet the criteria to move to the next color. And so what does that mean essentially for us in Long Beach? In Long Beach, in the purple category of where we're in, and again, we're in this category and everyone around us is in this category. And I think Kelly will respond. I think Orange County's in this category, San Bernardino, Riverside counties, all the counties up and down, for the most part, up the coast in our area are in this purple category. For us, what that means is that we have essentially we have met all of the reopening kind of criteria in purple. There is only one type of business that the County of Los Angeles can contemplate to reopen as part of our city, and that is salons and barbershops in the purple category. They also allow partial reopenings of indoor malls, but we don't have any in Long Beach, so that would not be applicable to us. But in the purple category, we can contemplate reopening salons and barbershops. I say contemplate because that doesn't mean that we are going to reopen salons and barbershops indoors at a limited capacity. That's a decision that the health teams and the doctors at the LA County Health and at Long Beach Health will decide and discuss over the next few days. But the reason why I say that is because for all other types of businesses, nail salons, restaurants who may want to open indoors, bars that want to begin to reopen, or other types of businesses, we can't even contemplate any other type of reopening at least for the next 3 weeks, because that's 21 days. So the only thing that we can actually think about within our category is essentially salons and barbershops at a limited capacity indoors, even though we know a lot of them are open outdoors. And that's something that we have to discuss. But again, we could be in the purple category for an extended period of time if we do not get our positivity rate under 8%, and if we do not get our case rate under 100 per 100,000. I know this is a lot of data, but I just want to I think the best way to think about it is we are in purple, and we're not expected to meet any of the state's benchmarks for any other business opening over the course of the next few weeks, with the exception of just barbershops and salons, and that discussion will be had with LA County Health over the next few days. So we shouldn't expect those to open anytime soon, but they could if the health indicators are positive. So I know that's a lot of information, and we know that it's also complex, but we wanted to get in front of folks today just so that we can, that the media especially, could share and ask us questions on where things are at. All of the information about how the reopening plan works, and this is not a Long Beach system, this is a statewide framework, is available at covid19.ca.gov. That's COVID, the number 1919.ca.gov. And so again, we know this is difficult for businesses, but at the end of the day, we are focused on public health. We support the governor's framework. We support that he's taking a very cautious approach to additional reopenings. And we do want to thank him and his team for working with us on this as well. And so with that, I know our health department director is here. If there are any questions, we'll answer what we know. But again, we just got this information today. So Kevin.
Thank you, Mayor. We'll now take questions from the media. First question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, can you share more about how long you expect it to take for Long Beach to know when it'll make a decision on salons and barbershops, and what factors will be included in making that decision?
Let me just say this one way. So one thing that's important to note that the state changed today is the way data gets reported, so actually when those decisions can actually be contemplated. So moving forward, the state was putting out essentially data every day, if I'm not mistaken, Kelly. Now the state has announced that data will be released once a week, which will be Mondays. They'll be putting out all the statewide data. And then on Tuesdays, the city will be able to analyze and get that data. Is that right, Kelly? Yeah. And so I just want to just preface what you had mentioned. So we'll be able to look at kind of where we are from a state perspective in a once a week snapshot. And that ends up working out because, again, there's a 21-day window for there to be any change anyway. So that's a difference. So it's a Monday and Tuesday snapshot look at data. Your question relates to when the decision around barbershops and salons will be made. And Kelly might know differently. In my conversations that I've had today with county officials, I understand that over the next few days, LA County will be meeting with our Long Beach officials and Pasadena, and the medical teams will be making that decision jointly over the next few days, looking at all of the data. And did you want to add to that, Kelly, or does that capture it?
So we'll know all the different data elements and what LA counties and everybody's looks like on Monday.
Yeah, and so it looks like, Haley, also that on by Monday or Tuesday of next week, the teams will have met and looked at all the data and probably made, I think by early next week, there will be some decisions made about if and when salons and barbershops could open in Long Beach and how they would open from a limited capacity perspective. But I don't want to get also folks' hopes up that somehow they're going to open up on Monday or Tuesday or Wednesday in Long Beach. We just don't know. And that decision is not a decision that I make or any policy person. We're getting our recommendations directly from Dr. Davis and the Department of Health, and we want to hear what they have to say after they talk to our hospitals and everybody else.
Thank you, Mayor. Next question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hi there. I know that this specific decision I'm about to ask about, it was made by the state, but I was hoping maybe Kelly could shed some light on why the state might be singling out nail salons as opposed to hair salons and barbershops, allowing hair salons and barbershops to do indoor services and nail salons still have to do it outdoor. I'm wondering if you guys could just shed some light on the thinking there.
Hi. So the So they parse out the different hair salons and personal services, and nail salons and all the others are considered a personal service. So personal services, it looks like that they would be available to open indoors with modifications under the red tier. And so right now, when we originally were closing down, they parsed out the difference between hair salons and personal services. And so they're continuing to do that. And the key pieces are it's much easier so when you're cutting someone's hair, you can be behind them. Most of the time, there's not as much interaction face-to-face. And because when you're doing nails, then it's always face-to-face interaction, whereas hair, a lot of time, it doesn't have to be. And then the other reason why they're looking at salons is it's appointment only. It's very easy to manage how many people come in. And it's also very easy to contact trace because you have the appointment schedule in case there are any exposures.
Thank you, Kelly. That's it for questions. We will now move on to Spanish interpretation.
Muy buenas tardes y gracias por acompañarnos. Hoy es nuestro comunicado de prensa para el viernes 28 de agosto del 2020. El anuncio del gobernador de hoy se refiere a un nuevo marco y no se trataba de una reapertura del estado. Como vimos, Long Beach no está solo en la lucha contra COVID-19. En el marco de colores que se anunció hoy para el estado de California, las regiones están midiendo con dos criterios. La primera es la tasa de casos nuevos y la segunda es la nueva tasa de positividad. Esto significa que tenemos que tener al menos menos de 100 casos por cada 100,000 y estar en una tasa de positividad menor del 8%. Ahorita la ciudad de Long Beach está a 168 casos por cada 100,000. No llegamos a los 100 y la tasa de positividad de hoy es al 8.8%. A la fecha hemos perdido un total de 212 personas en la ciudad de Long Beach. Los 4 colores de los niveles empieza con el color morado, baja al rojo, después al anaranjado y termina con lo más mínimo que es el amarillo. Estos criterios determinan en qué nivel caemos y el nivel determina que si se puede abrir y cómo. Quiero mencionar que cuando uno llega a un nivel, tenemos que estar ahí por al menos 21 días antes de seguir al siguiente nivel. Ahorita la ciudad de Long Beach está en el nivel morado y tendremos que estar ahí por lo menos por 21 días. Estar en el nivel morado significa que tenemos una tasa de positividad de más del 8% o más de 7 casos nuevos de COVID-19 por cada 100,000 personas por día o menos de 100 casos por semana para poder movernos. En términos de aperturas, estar en el nivel morado significa que la mayoría de los negocios al interior no esenciales siguen cerrados. Long Beach, junto con el 87% del estado, cae en el nivel morado. Una cosa que quiero mencionar es que el nivel morado permite que los salones de belleza y peluquerías podrán abrir en ese nivel, solo que necesitamos la aprobación del Departamento de Salud del Condado de Los Ángeles. Entonces, hay la posibilidad de poder abrir bajo el color morado a esos salones de belleza y peluquerías, pero todavía no está garantizado. Tenemos que tener la autorización del Departamento de Salud de la ciudad de Los Ángeles. Negocios como salones de uñas, restaurantes, no se pueden abrir al interior en el color morado. Para pasar al nivel rojo, lo que significa que todavía tendríamos un riesgo sustancial, necesitaríamos llegar a una tasa de positividad del 5 al 8% y no más de 4 a 7 casos nuevos por cada 100,000 personas por día. Y tenemos que mantener esa tasa durante al menos 2 semanas. Una vez lleguemos a nivel rojo, como mencioné anteriormente, tendríamos que estar ahí y quedarnos por al menos 21 días antes de poder ser elegibles para mover a la siguiente escala, que es la escala anaranjada. Después de llegar a la nivel anaranjado, podemos bajar al amarillo después también, como mencioné, durante 21 días. Hoy la tasa de positividad de Long Beach está al 8.8%. No calificamos para el nivel rojo, estamos ahorita en el nivel morado. Lo que sí pueden hacer ahorita es visitar el sitio del estado, sitio de web en covid19.ca.gov. Otra vez el sitio de web que va a poner la lista de industrias que se les permite reabrir basado en los niveles es el covid19.ca.gov. Podrá seleccionar el condado en el que vive y para Long Beach pertenecemos al condado de Los Ángeles y seleccione la industria que le interesa ver para poder saber qué es lo que va a seguir a continuación. Tendremos más datos e información local para compartir en relación con el anuncio del estado de hoy en nuestro comunicado de prensa la semana que viene. Gracias por acompañarnos. Eso es todo por hoy. Thank you for joining us. That is all for today.